Selena Gurley serves as the Vice President of Accreditation at Fast Pace Health, where she has been instrumental in achieving accreditation for over 265 clinic locations across 6 states. A family nurse practitioner and certified rural health clinic professional, she brings a wealth of experience to urgent care operations and quality improvement. Beyond her role at Fast Pace, Selena is deeply involved in advocacy for patient-centered care in the urgent care space. Welcome to DX, the podcast, Selena.
Yeah, thank you so much for having me.
Yes, so delivering care in rural Tennessee, but also having a broad view of industry, right, through the whole lens you have with your advocacy work at the national level. Talk me through your definition of urgent care, especially kind of at this inflection point we are with the urgent care space.
Yes, it really is amazing. If anyone who's been involved in urgent care over the last, decade or so, it has really morphed into something different than what we're used to.
Oh, yeah.
It used to be you would treat and street folks, bring them in, get them out, say, hey, if you need further care, we'll get things initiated, and then you'll follow it with your primary care. But it's really morphed into something more because people are coming to us for primary care needs. The blood pressure issues and the diabetes doesn't stop and sit in the car
Correct.
while they're waiting for their urgent care visit. And so we have to be an all-inclusive kind of touch point for patients during their time of need. And so urgent cares really embrace that and understand the pivot that's needed to be relevant and take care of the patients when they need us the most.
Which is so fascinating because, to your point, what was originally treat and street is now a much more holistic approach. And certain communities differ from others even. So we'll see that in some communities, it's totally fine to be the treat and street clinic on the corner, but in others, you may be the only clinic. So talk to me a little bit more about that rural health perspective and where you've seen urgent care step up to the plate and kind of how important that is, essentially.
Yeah, absolutely. So Fast Pace was founded in just the rural space. The need that we need to keep our rural communities with the same access level of care that our more urban brothers and sisters have. There is a place, as you said, for every kind of level of care delivered in the urgent care space, but you have to treat your markets different. You can't do for your urban areas the same as you do in your rural markets, and you really have to know the communities that you're taking care of because the needs differ. And so a few examples I'll give you is, one of our locations is near a sawmill, and the closest emergency room in either direction is about a 30-minute drive. So whereas the urgent care is about a 5-minute drive. And so we've experienced some, issues in that urgent care space of, workplace injuries and things like that maybe other areas would not. And so we got really good at removing splinters for sure. And amongst other things, to support the community there. And then another example that I can give you is we had a predominantly African-American market that we brought in a very seasoned provider that was Caucasian. And we knew that they were going to rock it, and we didn't have the response from the community we anticipated. And so we were really concerned and had some really good, smart people dive in to the community and hold town halls and say, hey, what is the issue? What are we not meeting? And it was a cultural trust issue because of the differences of culture there. And so what we decided to do is meet them where they are. And the provider went to church with our African-American clinic leader and got to know the community.
Love it.
And became very welcomed in that community and became part of that community. And we saw the trust factor go up and patients come in to where we could care for that community. So just you have to know who you're caring for.
What I love about both of those stories is that it all starts with the patients that make up that community. And I think what's so special about that is we're all patients too.
Yes, absolutely.
And so if we think about, if someone cared enough to think about who we are and what, the fabric of our community and what our needs are, what a huge way to impact your community. And to your point, to overcome those barriers where people feel like, oh, do I want to go to that clinic? Do I not? Are we sure they're going to be able to care for my needs? The sawmill, for example. I went there a month ago and they couldn't take care of this cut. Are they going to be able to take care of it now? But when you step up to the plate and you train those providers in a way that is specific and necessary to that community, it's a game changer.
Yes.
They're going to come back.
It's all about trust.
Yes, absolutely.
Yeah.
So tell me a little bit about that perspective when it comes to hiring providers, because what that looks like then is there's very specific providers for an urban market and very specific providers for maybe a rural market. Are there specific ways that you have decided to kind of market your positions, or is it kind of come up in the interview process? Like, how do you walk through that?
Well, recruiting in the rural market is very unique because the recruiting pool is smaller because the location is smaller, and so there's some travel aspect. And then these are people that you see at Walmart.
Yeah.
They come back to their communities after graduating from school, and they want to take care of the people that took care of them and help them grow. And so I think what we do is we're very much about culture at Fast Pace, making sure that we meet the patients where they are and what their needs are instead of trying to fit them into what we have.
Right. So not just filling a space.
That's right.
But looking for the square peg in the square hole instead of the round peg in the square hole.
Yes.
And yeah, absolutely.
Well, that meet a need, see a need, fill a need.
Yes. Yes, for sure. So I think what I'm hearing from you is that we want to allow our patients to kind of set the tone, set the narrative for the direction that we should go. And that can be hard, right? Because we have all these operational pressures. We have all of these specific kind of standards of care are important, but they're, right, when you get down to the nitty gritty, it's like every single clinic maybe can't theoretically operate the exact same way or have the exact same providers. So how do you balance that across a large organization?
Well, we at Fast Pace, as everyone we hope does this, we put the patient in the center of every decision that we make of like, well, how does it affect the patient? Because as you said earlier, we are all patients, right?
Yes.
And I want to treat my patients as if they were my family because I would want the same for me.
Yeah.
We are very strategic in the way that we meet because patients are smarter now post-COVID. Before COVID, we really did, I don't want to say a horrible time. We didn't. But
You're so kind.
Yeah, we did. We would try to make the patient fit what our model was in urgent care. Or we would try to make the patient carry the load or the burden of what fit for them. And then once they became educated with COVID, because it was a necessity during that time, they understood their choices. They became smarter consumers in their health care. And now we're in their game.
Oh, yeah.
They choose who they go to, and we've had to elevate what we do to keep up because they're smarter and they know they have choices, and we have to, convenience is very important now.
Yeah.
Telemedicine was a game changer for all of us, patients included. So I think that is kind of the different perception and paradigm that we've had to shift, not only in, how urgent care is morphed, but how the whole kind of recipe together with patient and caregiver are, we can't cook anything worth cooking if we don't have both of those. And so we really have changed that based on where the patient is and what their needs are.
Thank you for that perspective. I think it's really helpful to just understand and level set for where we are in urgent care and learn from where we've come, which it's always great to look back to see where we've come from, but really exciting to see where we're moving towards. So
absolutely.
Appreciate all the work that Fast Pace is doing.
Thank you so much.
Yes.
Thank you.
And thank you for joining us on DX the podcast. We'll see you again soon.
Yes, thank you. It was an honor. Thank you.
Yes. DX the podcast was born out of the idea that we are ready to diagnose the future of urgent care with the smartest leaders in the industry. Find all the other episodes on Spotify and LinkedIn to keep up with us in this journey.